and thank you so much for being here with us tonight for our latest Beauty Triangle webinar. It's great to have so many of you here. I hope you're all well and safe, and you've been enjoying the beautiful weather we've been having of late, very un-English. And for those of you who don't know me, my name's Francesca White, and I'm the founder of the Beauty Triangle. So for anyone new to our webinars, the Beauty Triangle is a platform designed to get people talking about their health and well-being, but always in a holistic and a responsible way, which means our conversations revolve around a single topic, and they always include a panel of 3 speakers who are all experts in their own field. Because working with genuine practitioners means that we can put the most accurate and reliable information out there. And that's important because our health, whether it's our skin, our bodies, or what's going on inside of us is really precious, especially right now. Which brings us to the conversation we're having tonight, which is all about prejuvenation. Now, prejuvenation has become a bit of a buzzword in beauty, but actually it's not about following trends or aspiring to be a version of ourselves that we're not. It's more about how to stay looking and feeling youthful, no matter our age, while also remembering to celebrate what makes each of us unique. So we'll be discussing everything you need to know, from how to boost your collagen levels to how to keep our skin glowing, but also how to maintain a healthy, safe self-esteem as aging does occur, which sadly it does. But however, we are joined by the most brilliant panel of experts to help us with the conversation, including aesthetic doctor and founder of Adonia Medical Clinic, Dr. Ifeoma Ejikeme, aesthetic doctor and maxillofacial surgeon, Dr. Joanna Christou, and celebrity facialist Abigail James. So there'll be plenty of time at the end to answer the questions that you might have, so just pop them in the Q&A box at the bottom of the screen and we'll do our best to make them a part of the discussion. But that's enough for me anyway. I've spoken enough. I'm going to hand over to our fabulous panelists to say a very quick hello, and then we're going to get started with the one-to-ones. Over to you, ladies. Ifeoma, would you like to start? Say a quick hello.
Sure. Hi, everybody. My name is Dr. Ifeoma Ejikeme. I'm the founder and medical director of Adonia Medical Clinic based in West London. I'm also a medical consultant and a senior lecturer in aesthetic medicine at Queen Mary's University.
Perfect. Thank you. And next we're going to have Joanna Christie.
Good evening, everyone. I'm Dr. Joanna Christou. I'm a cosmetic doctor at the Cosmetic Skin Clinic, which was founded by Dr. Tracy Mountford. That's based in London and Buckinghamshire.
Thank you, Joanna. And finally, Abigail.
Hi, I'm Abigail James. I am a facialist. I've been in the industry for 20 years. I have a clinic in central London in Mayfair in the Beaumont Hotel, which is unfortunately still closed, but hopefully I will be back in clinic very soon.
And we will all want to be there to join you. Gosh, your clinic at the Beaufort, so beautiful. I've completely missed sort of trips into town to do things like that. So thank you, all of you, for being here tonight. I'm going to start with Dr. Ifeoma, who is our first panelist, founder of Adonia Medical Clinic, as she mentioned, where she has a device, a laser, and a peel for basically every skin type and color, which we're going to find more about very soon. And so Ifeoma, thank you for being here tonight. Let's start with the skin, because that's often the first place where we start to notice those signs of age creeping in. What are the changes exactly that occur to our skin from our mid-20s onwards? And I guess what's sort of happening as a result of those changes?
So from your mid-20s, there's so many changes that start, but the one that's most significant is the change in elastin and in collagen. So from about the age of 20, even as young as 18 in some, you start to produce about 1% less collagen every year. So overall, your collagen gets depleted. And there's certain areas of the face that you'll notice that. And in your 20s, the area of the face that has the thinnest level of skin or density of skin is around the eyes. So this is
I've heard it's like 5 skin cells thick or something crazy.
Absolutely. This is the area that you start to see that loss of collagen. So collagen is key. Collagen is key, and collagen loss is really what's happening in your 20s.
It's so true. If we take one thing away from this webinar tonight, I think it's going to be the importance of collagen. It's basically the holy grail, isn't it? So very much talking about the need to bank as much of that as possible. Yeah. I guess, one of the cornerstones of good skin is definitely good skin care. So, in your opinion, what are the ingredients that we need to start thinking about incorporating into those regimes to, you know, not only protect our skin for the future, but also to keep it looking, you know, really great in the present day.
Absolutely. So when I think about skincare, I think about 5 main elements: your cleanser, an antioxidant, your moisturizer, and your sunscreen. These are your 4 key. And then you have your treatment step. So depending on your skin type, your treatment step will change. But when you're thinking about anti-aging, your treatment step becomes very, very important.
Okay.
So those are things like retinoids. So there's anything that's going to cause a continual increase in collagen. And there are 3 elements that are very good for this. Your vitamin C, which helps with the increased collagen. It's also an antioxidant, so protects the skin against free radicals, which are these energized molecules which cause damage to our skin. So that's the first. Your vitamin C, niacinamide, which also helps to produce collagen, and retinoids. So these are kind of your hero ingredients. Outside your number 1, which is your sunscreen.
And how long do you think it takes to start seeing a difference in the skin after making a swap to using these sorts of ingredients?
So usually I'd say 3 skin cycles. So whenever you start a new skin regimen, 6 weeks is the absolute minimum that you need to give it. But 3 skin cycles is 3 lots of 6 weeks. So it's actually 18 weeks. So starting a retinoid, you wouldn't expect to see dramatic change in your skin until up to 18 weeks.
Okay, and is there something also to be said for making these swaps sort of gradually? Because I mean, you don't also want to aggravate the skin with something as punchy as a retinol. And I've seen sort of cases where, you know, some girls are obviously sort of trying to address, you know, sort of lines, wrinkles, things that they're really worried with, and suddenly they're sort of slapping it on and it's all too much too soon.
I'd agree. So that those 4 main elements, your cleanser, your antioxidant, your moisturizer, and your sunscreen, it's really simple, just that. Now your treatment step is where you bring things in really slowly. So your vitamin C would probably be the first thing you bring in. And I don't recommend that every day. I usually recommend that 3 times a week to start, because some people are even sensitive to vitamin C. And then you've got your retinoid. And your retinoid, again, you bring that in really slowly. I recommend about twice a week to start, the lowest strength of any brand you go for. And if you're really sensitive, you can do the sandwich technique. So the sandwich technique is where you have moisturizer underneath, your retinoid, and then moisturizer on top.
That's quite interesting. So it sort of buffers it and gives it that natural sort of protective barrier.
And you slowly move forward with that. So 3 times a week you do that, and you work your way up to 5 times a week. Once your skin can tolerate it, you then take off your bottom sandwich. So you end up with retinoids and then your moisturizer.
Oh, very smart. I love that. And great that you mentioned SPF as well. I mean, if there's one product that we need to be applying every single day to our entire faces, regardless of what Gwyneth Paltrow might say, it's definitely the SPF.
It's SPF 30 or above. I like factor 50 every single day.
Yeah, I'm with you there as well. I think a really nice way to up the ante when it comes to facial treatments is a great sort of clinical strength peel. And I know you're offering some really interesting ones at Adonia. For someone who's never had a chemical peel, like what's a good entry level treatment to get the skin really glowing?
So it depends what your skin, if you have oily skin, then a salicylic peel, like a 10% salicylic peel is great. If your concern is more hyperpigmentation or you have dull skin, then in most skin types, a glycolic peel. If you have sensitive skin, then a mandelic peel can be great. So those would be 3 peels that are kind of great entry-level peels. Now, the one that I would say for people who have really sensitive skin, who are either very worried or never had a peel before, or have sensitive skin, is a hydrating peel, like a lactic acid peel. So a very low dose lactic acid peel is really good.
And what is the downtime on sort of the general chemical peel that you're offering at Adonia? How long could somebody expect to be out of action for? I feel like peels have been tainted since
they have.
Sex and the City, Samantha. That's where her face practically falls off.
So it depends on the level that we're treating. A very superficial peel can have no downtime. Even 1 day of some mild crusting or none at all. A deeper peel is usually about 7 days, and that's a medium depth peel. And then a deep peel going into the deeper levels of the dermis, we're talking about 14 days at least. Okay, great. And you've got a really cool one, which you were telling me about recently at Adonia, the VI peel, is that right? Yes, we just brought in the VI peel. The VI peel is a really interesting peel because it mixes quite a few things. Salicylic acid, It has retinoids in it. It also has phenol, and it's quite unusual in the UK to see phenol peels.
It really is, yeah.
Yeah, and one of the great things about phenol is that phenol takes away the sensation. So it's a painless peel.
So when you're actually lying there on the treatment bed, you won't sort of have the sort of prickly, hot sort of heat going on.
You feel something for a few seconds and then that's it. It hits the nerve endings and then you don't feel anything. And this peel, whilst it's a medium depth peel, it actually behaves a lot like a superficial peel. You don't have that face-off snake shedding with this peel. It's really quite gentle because you administer it throughout the day. So we do the peel, then there's extra bits that you do through the day to kind of take that peel a little bit deeper, a little bit deeper, a little bit deeper.
Okay, so you sort of gradually build up to it, much like you were talking about the skincare, sort of slowly.
Yeah, so it's a nice peel for all skin types.
Yeah, and also really nice for this sort of age category that we're talking about, which is all about the Prejuvenation. You know, you don't want to sort of launch straight into the more hardcore sort of stuff. I mean, like myself, you're a huge fan of supercharging time that, you know, we all spend lying on your treatment table. What are the add-ons that you're incorporating into things like your medical grade facials, you know, in order to really get the skin sort of turning over and working as best as it can do?
So there are a few things. So the facials that we offer in the clinic, we have the LED, we have hydrofacial, we have microdermabrasion facial, we have dermaplaning, and we have oxygen. That's the last one. And so those are the 5 main peels. Now, the things that we can add to them are things like microneedling. So we have the Adonia Golden Facial, which uses aqua gold. And the key difference here is that rather than microneedle, where the needles are closed, with the aqua gold, the needles are hollow.
And so this allows you to sort of deliver active solutions and ingredients into the skin to really sort of help it.
Yeah, and it can be everything from PRP to your hyaluronic acids to vitamin C's. And so whatever your skin needs, we can tailor it during that facial. So we can do things like cleanse the skin, do an aqua gold facial where we're doing PRP to the level of dermis, and then do LED so you go home without looking red, you know, or red in most skin types. So these additional things we can add in. Also the high-tech facial, where we can do a general facial and then add in HIFU, which is high intensity focused ultrasound to stimulate the collagen at the dermis, and then do LED. So again, you go home looking pretty good.
I love a bit of HIFU. I mean, it's interesting because all of these things that we're talking about, you know, the microneedling, the HIFU, even the LED to some extent, they're all designed to sort of trigger that wound and heal response in the skin, aren't they? And I guess that's again sort of what we're always aiming for in terms of Prejuvenation, in sort of really stimulating the skin to produce that collagen. And sometimes that does result in a little bit of downtime, but not to say no pain, no gain, but actually sometimes you have a little bit of redness, a bit of flushing, and I sometimes think it means these things are working.
Yeah, I agree. And it's that difference between having one treatment where you have the time to have downtime, doing like a medium depth or a deep chemical peel where you have the time, or not having the time to have downtime, and then doing a series of more superficial peels, and you get there either way.
It's so true, and right now in lockdown, wearing face masks is probably the ideal time to be doing all of these more sort of exactly sort of downtime focused treatments. You mentioned the HIFU, and that's obviously one amazing energy-based device. There are sort of others, you know, radio frequency, laser, and I know you've got sort of all various things going on at Adonia. And I think they're a really great middle ground, you know, for those patients who think their skincare might no longer be cutting it, but maybe they're not quite ready for the injectables. So what are the things that you offer? And I suppose what are the devices that are best suited to which skincare conditions?
So it depends. Something like if somebody has sensitivity or rosacea or even redness in the skin or telangiectasia, visible vessels, then you might consider something like laser. So there's some peels that will address that, like azelaic acid, amazing for vessels and redness. And then we might want to actually shrink those vessels down with a laser. And we have an Nd:YAG laser, so we can use that to target those vessels. Now, if somebody's key concern is hyperpigmentation, then we might use skincare in the clinic, skincare at home, to help suppress those pigment-producing cells, and then do a medium-depth chemical peel.
So you're always sort of layering them with the other devices, which is really nice as well.
And then if the key concern is hydration or dull skin, something like doing a hyaluronic acid skin booster can be a really great addition in something like Profiler or Volite, to inject it throughout the face to help boost the skin and give you that glow from the inside out. You know, hyaluronic acid holds on to 1,000 times its weight in water. So you see that in the skin, you see that in the boost and the glow that it gets through in the skin.
Yeah, it's a really nice thing to be thinking about. And I know sort of the microneedling that you spoke about earlier, that's a sort of great way of stimulating the body's natural production of hyaluronic acid as well, isn't it? Plus the elastin and the collagen and all these lovely elements that sort of keep the skin sort of together and sort of lovely and plump and juicy. What about things like acne scarring? Because you know, we're talking about prevention, and obviously acne is something that can predominantly occur sort of in teenage years, but it can really linger, particularly the scarring, and it can be sort of a bit of a cruel reminder of, you know, your sort of skin woes of past. But are there any sort of devices that you have that can really address that and sort of get the skin back to a more even keel?
Absolutely. So with scarring, I think about it in two different ways. Is it pigmented or red, or is it textural change? So if it's a color, that the color is different, because that's either in lighter skin types it's red, or in darker skin types it's pigmented, then we're going to address it with at-home products as well as peels or lasers. So in the red, it's azelaic acid with some laser, and avoiding microneedling because that will actually inflame it, but instead use azelaic acid peels. Those are fantastic. If it's pigmented, we use tyrosinase inhibitors and we use chemical peels. Now, for texture, we want to do something. So the gold standard for texture is Subcision.
Yes.
So
that's like cutting through the, I suppose, the scar tissue in a way.
The scar tissue. So is to use a blunt device or even a needle device, quite a large one, relatively large. And we go in and we just lift up that skin. And I like to place PRP underneath that. So we've done Subcision with PRP. And that just gives the skin another opportunity to heal.
And the PRP is really interesting. Like for anyone who doesn't know what it is, maybe you can explain a little bit more about how that works, because that's a really nice way, I suppose, of using the body's own natural resources in a way to stimulate that sort of skin rejuvenation, isn't it? So it's a nice one for those entry-level patients.
Yeah, so PRP, or platelet-rich plasma, is a treatment whereby you draw blood, spin it down, and it's separated into its component parts. And the elements we're really looking for are the platelets and the growth factors. There are tiny amounts of stem cells found free in the blood, but this really isn't the focus of it. It's really the stem cells and the growth factors. Now, when the body has some form of injury, one of the first things that happens is the stem cells degranulate, so they break. And when they break, it tells the body that we need to send different messengers to help them. That's new blood vessel growth and different components of the skin to help heal that area. That's essentially how we heal. Now, PRP is kind of trying to trick the body. So it's taking that blood, getting those stem cells, activating it, and then injecting it into an area. So it tells the body that we need to heal this area. So it gives the body another opportunity to heal down a scarless pathway. So it's down the pathway that doesn't lead to a scar.
I mean, you spoke about sort of incorporating the PRP into other treatments, but how many sessions of something like that would you normally want to do in order to see results in the skin?
So with scarring, I would say minimum of 6. When you're adding in Subcision, you definitely get much more of a boost, because every time you do Subcision, you have a lot of healing. So those two together work really well.
Oh, really nice. And so, you know, we've obviously been speaking a lot about the energy-based devices, that the HIFU, the, well, sort of not microneedling so much, the LED, but a lot of these devices also lend themselves really beautifully to the body, don't they?
Absolutely.
Maybe you can tell us a little bit about the sort of machines that you have in clinic as well that will help to keep our bodies sort of feeling in shape and sort of their best version sort of as the future approaches.
So in the clinic, we have 2 main devices. One is fat freezing and one is skin tightening. And I brought these in because my patients were asking for them, you know, and it's really interesting with lockdown. People seem to have a much more focus on the body now because of our faces are covered in masks. So having devices that can address those little pockets of fat, like the stomach, the love handles, also to sculpt and contour.
Exactly.
A lot of people,
our body's ready to sort of get back into summer clothes. I mean, it's sort of scary sort of looking at the things that you might have to be wearing in a few months.
Definitely. And even contouring, you know, some people are relatively slim, but are built straight and they want to have a bit more of a curve. And this is something that no matter how much you diet or you exercise won't really change. So having devices that you can kind of sculpt the waist a little bit, do things like the bra bulge, the tops of the knees, even the thigh gap. These sorts of areas we can address with fat freezing and with skin tightening.
And is there a certain age that you would start to consider these devices? I mean, it's very clear cut when you come to the face and the skin. You can see when those sort of age-related changes set in, but at what age, sort of at what stage of life should we be actually considering these devices? Because they are a bit of a commitment, they're not always cheap. And so when would you say is the best time?
So skin tightening usually isn't something that people under the age of 30 require. It really does depend on the body. There's no real age cutoff, but it just depends on the body. Usually after pregnancies, the skin is stretched a few times and the stomach is an area that does change. And I've seen that in myself. It changes. You may need to firm that area up if it concerns you. Now, the arms tend to be in your 40s. Skin tightening usually in your 40s in the arms and in the legs. So it's that sort of area. Now, with fat freezing, it's very different. Some people can develop a pocket of fat underneath their chin, which is genetic, which no matter how much weight they lose, that pocket doesn't change. So in the 20s, that can be an appropriate treatment for some people. So it really
I guess the things that you're sort of genetically predisposed to, sort of maybe look at your parents to sort of see where you might end up.
Yeah.
Does the skin on the body age in the same way as the skin on the face? I mean, is the cell turnover sort of slower? Is it the same rate?
It actually doesn't, but the biggest reason why we feel it does is because of sun exposure. So there are two main forms of aging. There's intrinsic aging and then there's extrinsic aging. So intrinsic aging happens to every part of the body uniformly. There's some areas that are thinner that we may notice it earlier, but this is your genetic hardwiring, things that are internal that we can't really change. Time, gravity, we can't really change those things. Extrinsic, on the other, and especially the biggest of that being sunlight, affects different parts of the body differently. So your face, your hands, your feet, mostly your face and your hands, you'll see the signs because of extrinsic factors, because of the sun. So that's why we feel as though the face and the hands age at a different rate.
Yeah, that's so true. And I guess all of these sort of body concerns can be enhanced by, the right skincare products, and then even things like the chemical peels that you were speaking about earlier.
I think it's about thinking about doing things on a loop. So you have your treatments that you have your skincare that you do every day, and then you have something that you're doing to continually stimulate collagen. And that could be lots of different things. You can pick the one that suits you best, whether it's microneedling or HIFU or chemical peels or radio frequency, just something that you're doing.
It's so true. Everyone sort of has an affinity, I feel like, with a certain thing. I know for me, radio frequency is always my go-to, but for everyone, they'll have their thing that they get results from.
And you match that to your key concern as well. If your skin tends to be red, laser might be the thing that you do every year that also stimulates collagen. If it's pigmented, it might be a chemical peel to keep it at bay. If it's anti-aging, it might be radio frequency or HIFU.
I think it's a really good point, especially at the sort of entry level, sort of maybe the younger patients who are starting to gradually venture into this world of aesthetic treatments. It's good to sort of find the thing that you feel really works for you, and make that sort of your investment and the thing that you do for yourself. Ifeoma, that whizzed by, and that was completely fascinating. So thank you very much for all of your help and your tips. That was just super.
You're welcome.
Thank you. Our next speaker, Dr. Joanna Christou, as she mentioned, works from the Cosmetic Skin Clinic. Now, Joanna is an expert in the sort of entry-level injectables. Well, in fact, injectables at any stage of life, really. But I've always found her approach to treatments like, Botox and filler very unique. So, Joanna, firstly, thank you for joining us this evening.
Thank you for having me, Francesca.
Always. As an aesthetic doctor and maxillofacial surgeon, I always stumble on that word, you're looking at the face and how it ages from a very anatomical perspective. So maybe you can just start by sort of explaining to us how the face structurally changes as time goes by.
Yeah, well, the facial anatomy is very complicated, and the aging process is multifactorial. So there's no one thing going on. As Dr. Ifeoma mentioned, there are skin changes, and that's what we can see most superficially. But underneath that, we have bones, we have muscle, we have ligaments, and we have fat pads. And each of those change in their own time and present slightly differently on the face. So a lot of people will know that, or perhaps they don't, but the bones shrink. And so the orbit actually widens and the eye looks more sunken within the face. We lose those fat pads, and that starts to cause a bit of a slide downwards. So everything just looks a little bit different. You know, you don't have that same plumpness and fullness on the face. And that all happens in a very slow way, but we can start to detect those from a relatively early age if we've really got a keen eye on these things.
Yeah, it's really clever the way that you sort of describe all of these changes that are going on structurally, because I think actually what it does is it helps the patient to understand, you know, the supportive role of all the treatments that you then go on to do, and the reason that you're doing these. You know, injectables aren't just about beautification, really they are about restoring the things in our face that have been lost to time. Speaking of injectables, they're obviously one of the sort of foundational elements of your practice, you know, everything from things like Botox to skin boosters and dermal fillers. But again, at what age should we be thinking about having these treatments? Because it's quite a controversial question. And I think obviously it's not a very clear-cut answer always.
Yeah, and you're right, the answer isn't quite clear-cut. So really from a pre-rejuvenation point of view, so being proactive, I tend to say in early 30s is a really good age to start. And that's when you can start to see some of the fat pad volume loss, and you can work at just restoring a little bit of anatomy in a very clever way so that you don't change your face. But even earlier than that, some people do see some changes. So for instance, myself, now I'd be a hypocrite if I didn't admit to this. Studying a lot, I had quite a deep frown line in my 20s. I was 26 when I had my first Botox, just there, you know, it just softened the area. Did I need it? No, but I aged so much better as a result of these tiny little treatments at an early age, because...
And it probably made you feel so much better every time you looked in the mirror as well, not to see that frown line staring back at you then.
Yeah, and actually there's a really interesting school of research at the moment in the psychiatric world, where if you can't frown as well, because you don't have the negative reinforcement of I'm angry, I'm sad, I'm in pain, it actually changes the neurochemicals. I'm going off piece now, so stop me. It changes the neurochemicals in your brain, and they measure an elevated mood because you can't frown. So there's, you know, all sorts of medical reasons as to why even earlier than the 30s may be of benefit in some people, in select group of people.
And it's really interesting because there's definitely that link between sort of our physical appearance and psychologically how we then do feel about ourselves. And I agree, if something is bothering you, then yeah, surely you should be seeking treatment from, you know, a responsible, reputable practitioner who obviously agrees also that it would benefit you. I mean, much like yourself, I think I was told to wait off having Botox until I was in my 30s. I don't know if, you know, whether I'd had it at 29, if it would have made a difference, but it definitely sort of, I loved the lightness and the sort of, you know, elimination of all heaviness that it seemed to bring to my face as a result of having it. Let's talk about the skin boosters, because these have been really big business since launching a few years ago. And I think they're a really nice way to dip a toe in the water when it does come to injectables. I know Dr. Ifeoma mentioned some as well, but how exactly do skin boosters work, and who's best suited to them, would you say?
So the beauty of skin boosters is it doesn't augment the structure of your face as such, but it's a biostimulator, so you're growing more of your own natural collagen. With banking collagen, you age well. Yeah. So in reality, pretty much everyone would benefit from it at a certain stage. And the earlier you start, again, I'd probably only go for people in their 30s, but the earlier you start, the more you restore the anatomy, and it just goes very well in the long run there. So you have to, I mean, my personal favorite is Profilo. I don't know, you know, I think Dr. Ifeoma, you mentioned Volite as well. My personal favorite is Profilo. I just think it's so beautiful in creating, you know, plump, luminous, hydrated skin, and you glow after it.
Yeah, agreed. And I feel like there's definitely something different in the formula with Profilo. They talk about it being uncross-linked hyaluronic acid, don't they? So it does sort of spread beneath the skin very beautifully, but I feel like it definitely sort of tightens and somehow remodels the skin when you have applied it.
Yeah, exactly. And some people really genuinely see a bit of a lift and support as a result of that sort of sandwich of new collagen underneath the dermis. Now, I never tell people to expect that, because it doesn't always happen, but those who do see that kind of lift as a result are absolutely delighted. So it's you know, beautiful treatment.
You just have to warn people of the downtime, because it's not very extensive, but it does leave you with sort of quite noticeable welts almost on the face. Sort of you get these protrusions that are sort of slightly noticeable, I would say, immediately after being injected.
Yes, a few little blebs left on the skin which are quite noticeable.
Blebs,
so you can
exactly.
plan for that one, you know, nothing that evening, just go home and take it easy.
And they're great as well, because you can obviously apply them to different parts of the body, can't you? I know I've personally had it on my neck, and it's great for sort of softening those sort of necklace lines, which again I think can be very genetic. You know, they're not necessarily something that sets in sort of with age, but it's really nice there, nice on the décolleté, all over really.
Yeah, and coming onto the neck, I mean, people are noticing it more at the moment because, of course, we're all looking down, playing on our phones. So there's this whole tech neck thing. So it does work very nicely there. And in a slightly more off-label way, we can use it in, you know, backs of arms, on the tops of knees as well. So once Dr. Ifeoma's done her cool sculpting and tightening, you can just stimulate the collagen, you know, with a little bit of Profilo, and it does work very nicely wherever you apply it.
I did also hear that they're bringing out a body version of Profilo, which is super exciting. So rather than just using up the dregs in your sort of syringe that you didn't use on the face and injecting a bit, you'll have a whole new tool to your toolbox hopefully very soon.
Yeah, do you know when that's coming? Because they've been promising this for a year and I haven't heard anything lately. So please tell me if you know.
I feel like it's in the coming months. I'm sure you'll know more about it than I will ultimately.
Well, that's very exciting.
No, it will be. I'll be sort of first in line to come and try that with you. What about Botox? Because I think, you know, that's obviously you know, we spoke about the age at which you would determine whether a patient was suitable or not. But once you have decided that they're the right candidate for treatment, how do you administer the Botox in a way that leaves the face looking fresher, as opposed to sort of frozen and immobile, which is often the fear that many Botox newbies have?
Yeah, and you're right, because there are still, sadly, quite a few bad examples out there of these totally paralyzed faces that have no expression whatsoever.
And they give it such a bad rep.
It really does. But the reality is that all of these treatments, when delivered correctly, are imperceivable. So in the case of Botox, what you're looking for is just an augmentation of how the muscle contracts. So you're still looking to be able to frown, to be able to raise your eyebrows, and all the expression should be there, but it should just be a bit softer. So the face, you know, the face should look brighter and fresher and more relaxed, but definitely not done in any way.
Agreed. We sort of don't want to eliminate expression and sort of get that sort of awful glassy sort of forehead that just is completely sort of rock solid. It's very much just about targeting the muscles in a very artistic way, I feel, and actually I think you have to have an amazing understanding, as you obviously do, of that sort of muscular structure and understand how to target each one to get that desired effect. It's not simply sort of whacking in some Botox and all your lines disappear. Moving on to dermal fillers, because, you know, I sort of feel they're at the very top end of the spectrum when it comes to injectables. You have a really unique technique, something that you refer to as filler sprinkles. Maybe you can tell us a little bit more about those. I mean, how are you using them to support the face as it ages, and why are they sort of such a nice approach, I suppose, for somebody who's a bit wary of filler to begin with?
So the concept behind this is fillers. There's a way to deliver them that you yourself can't even tell where the filler is. And this is my goal. Patients come back to me and they say, I know I look better, but I can't tell why. They know what they've had done, but it's so well sort of amalgamated with their own anatomy that they can't tell. So what that involves is, it's to do with how much filler you do, of course. It's to do with where you place your filler, but it's also the order on where you place it on the face.
Okay.
And getting that all to be confluent with your own natural expressions from every single angle. Because, of course, we often look at ourselves directly in the mirror. Whereas
and you need to have a very 360 perspective of someone's face, don't you?
And in repose and on animation, because most of the time we're not, you know, deadpan looking straight ahead. There's often, you know, we're talking, we're laughing, we're eating. So with all those factors in consideration, what I will often do in a filler treatment plan, and a typical new patient treatment plan will take me 4 to 6 months to complete. And each patient will see me once a month through that time, and we'll do a tiny little bit each time they come. And rather than treating one zone on the face, so focusing on the cheeks or focusing on the jawline, because if you do just one area, that area looks
something else.
You look like you've had something done. So you might do a perfectly subtle result just here, but you still look like you've had something done because it won't match the rest of the face. It's like
you need to keep it very holistic and make sure that everything is being sort of targeted in a very complementary way. Yeah, so filler sprinkles are little bits everywhere, lay the foundation, let it settle a little bit more everywhere, let that bed in and settle in with what's previously done. And so you build a picture over time rather than there's your cheeks, there's your jawline. And it just tends to work very, very well in my hands. That's my experience of it's really nice because actually you and also Ifeoma have obviously both spoken about building these things up gradually. And again, it's a really nice message when we're thinking about prejuvenation. You know, we're not just sort of going in all guns blazing and sort of launching into the deep end of these treatments. We are testing the water slightly. And I think the filler sprinkles are obviously a nice way to do that. You spoke a little bit about the order being important in which you do treatment. So what do you mean by that? Is that the areas of the face that you're addressing? Are you sort of talking top to bottom or bottom to top, or how? It could be different things in different people, depending on the anatomy and depending on what they want to achieve. But as a general rule of thumb, and this is a broad generalization, top to bottom does work quite well. So, you know, temples can open up the eyes, and then when you do the cheeks, it sort of pulls out through the navel folds and so on and so forth. But that doesn't go towards the sprinkle technique. So you have to sort of pick a focus, but then just refine it slightly for the person in front of you. So it's very difficult to explain because it's so bespoke. So there isn't a rule of thumb as such. It's more a principle of treatment. And I think filler is probably the most difficult injectable to get your head around as a new patient, particularly. I think once you do have it, it's sort of like a light bulb going off and you're like, now I see how it works and what they're doing. But, you know, it's obviously all what lies beneath the surface, and it's very difficult to actually see the results of what you're doing. When you're doing the filler sprinkles, is it with a cannula, or is it with a needle, or is it a combination of the two? Combination, actually. It depends on the area I'm treating. It depends on the depth of anatomy that I want to reach, because fat pads sit at different layers in different parts of the face. So I don't have a rule on that, really. Yeah. And I think, again, that's important. You know, no two patients are the same. You won't ever be presented with the same two faces. So I guess you always need to be tweaking the order and the application, and maybe even the product that you're using as well. Absolutely. Yeah, absolutely. And you know, people are so often bogged down with the brand of filler that's being used, and what's more important is what's called the rheological properties. So it's the actual mechanical behavior of the filler that's correct for which area of the face you're treating, and that's far more relevant than a particular brand. So I always have to, well, not always, but I often find I have to undo kind of some thinking in some people when I meet them for the first time, and, you know, educate on how things are anatomically and how to treat. And it's just very interesting, some of the preconceptions that people come with. And as you say, when you start to make a start on some of these things, it is a light bulb moment. They go, you know, now I understand this, now I see this, and now it makes sense as to, you know, why I have this pocket here, for example. So it's lovely to meet people, you know, initially when they've never been to an injector before, because it's just a joy to be able to have those conversations and educate on some of these things that we all love and do day in, day out. So exactly, and sort of open up someone else's mind to the possibilities of these treatments as well, and in a way destigmatize it. You know, there's a lot of injectables do have a bad rep because of a lot of the work that we see walking around, sadly, but I think, you know, when you do experience it yourself and you have wonderful natural looking results, you know, that's the best experience you can possibly have. And I get lots of comments about, oh, you don't know because you've not had any treatment. Actually, I've been having injectables for 13 years on my own face. It's just, I don't look like it. So, you know. I know, you're like, oh no, I have been doing this for long enough, and this is a testament to my technique. I would certainly agree. You look incredibly fresh-faced. A final question, then we're going to move on to Abigail, but we've spoken sort of previously about this sort of layered approach to treatment. I know it's something Dr. Ifeoma does as well, in order to achieve those best results, and obviously a longer lasting outcome. But when it comes to the face and the body, what are you adding in to support that aging process, in terms of the supplementary treatments, and to also keep us feeling confident as time passes by? So when I think about
assessing a patient, I am thinking in layers. So I'm thinking, you know, filler for deep support and structural scaffolding. I'm thinking things like whole therapy for tightening of the muscle and connective tissues. I'm thinking of the muscles then, so Botox to augment how they behave. And then on top of that, the skincare. So a part of not being detected for treatment is getting those in the correct order. So for instance, and this is just a for instance, this is not how everyone would be treated, but you could start with a skin tightening treatment, assuming skincare is in order and they're already using their SPF and doing all of those things. You started with a skin tightening treatment. That is such a beautiful, slow, but very controlled process of tightening the skin. And then in a step-by-step way, you layer the filler together in the way that I've described earlier. And so it all just sort of comes to fruition together in a very smart way. So one of my personal favorites often is therapy, with a very staged, careful approach to filler. And then we just gently introduce the Botox and the profilos and things like that for the sort of cherry on top of the cake type scenario towards the end of the treatment plan. So it is just one example, but it does work quite well for a lot of people to think about that particular combination of treatments.
And it's really nice as well, because again, you're doing things very gradually. You're sort of creating this sort of imperceptible, sort of subtle, beautiful result, you know, rather than somebody coming out of the clinic and suddenly everything looks very noticeably done, which is obviously the last thing that anyone really wants to be achieving through these treatments. Thank you so much, Joanna. That was super interesting, very educational as always. Thank you for your time. So our final speaker is Abigail James, who, as I mentioned before, one of London's best known facialists. And in fact, Abigail and I were chatting yesterday, and I mentioned to her, she was actually the first facialist who I ever had a proper facial with back when I was a beauty intern many moons ago. Though I'm sure her technique has changed wildly since then. Abigail, it's so nice to have you here.
Oh, it's lovely to be here. Thank you for inviting me.
Not at all. As one of London's best known facialists, I mean, your knowledge of our everyday skin concerns is so extensive. But when it comes to our faces, what are the things that women, would you say, start worrying about from adulthood?
Firstly, I suppose what I just wanted to add, because obviously listening to these two amazing doctors, you know, dermatologists, and having that knowledge, it's amazing how actually the facial and the clinical side of things has really merged. Yeah. So actually, when someone's coming to me and saying, you know, what are their main concerns, it's going to be exactly the same main concerns that have already been mentioned. I think loss of firmness is a key one.
Definitely, especially as Joanna sort of said, you know, staring down into phones and awful Zoom screens where you get an awful view of your face, it can look very unfirm.
Absolutely. And I think definitely from the age of 40 onwards, that just seems to accelerate hugely. Fine lines around the eyes, that's usually the 20s that they start going, oh, well, I've just started noticing these around here. Interestingly, the kind of clients that find me, when I'm asking for their wish list, they're not necessarily saying smooth wrinkle reduction. And I know there's going to be a similarity with the kind of clients that find me, but they all want glow and radiance. And then, you know, they're going this and this. And then you've obviously got the things like pigmentation, you know, and obviously this nasolabial is a big area of concern as well. So I find faces obviously age in a different ways, but there's those common issues that we all seem to be concerned with.
Yeah, exactly. And I suppose that the sort of initial consultation you have, much like our other two speakers, is your chance to really you know, get to understand what those concerns are and really get under the patient's skin, sort of quite literally, and also to actually point out the things that maybe they think are incredibly noticeable that really truly bother them, that actually aren't all that visible on the surface. I think it's sometimes nice to have somebody to put your mind at ease about these concerns.
Definitely. You've got to allow them time to speak, because I could be looking at their face and going, oh my goodness, I so want to do this on them. But then they actually haven't mentioned that at all. And their target is something totally else.
Exactly. So you need to make sure you're all singing from the same hymn sheet.
Yes. So I do use a skin scanner, a Visia machine, which allows me, allows me to just kind of see a little bit further if we got any underlying redness, any inflammation, dehydration, all of those kind of things, the oil content in the skin. So it just allows me, and sometimes doing something like that, if I've been looking at, I think we've got some redness and inflammation, and that hasn't been their main concern, sometimes it can just match up those. So you're then kind of singing from the same hymn sheet, and you then kind of, you gain their trust as well.
Exactly, particularly in those sort of early stages when it might be a new patient or somebody who's only just starting having, you know, serious facials. I think, again, like our other speakers, that educational element and really showing them what's going on beneath the skin is really key to allowing them to understand the importance and the significance of having these sort of treatments done.
Any sort of knowledge is beneficial.
Is power, ultimately.
And I know we're talking about that Prejuvenation and the younger stepping in. Actually, I might be one of the first type of practitioners that they might see. They might not, you know, in their younger ages, their 20s, they might think, oh, I'll book in for a facial. And I know it's such a broad thing because not all facials are the same. So, you know, someone like myself might be that first treatment that they actually have.
Yeah, that's so true. And the first time they really up the ante probably when it comes to their skin. I mean, talking about your facials, you've obviously got an amazing array of different techniques, ranging from the sort of very science-based and very holistic. But what's your philosophy when it comes to treating the skin? I mean, what could we expect when we came to lie down on your treatment table?
Okay, well, I need to go into a full consultation with whoever before I treat anybody, and I want to know what's going on with their hormones, their stress level, their lifestyle, what kind of nutritional things. So I need to see just that complete picture. And often, you know, I find out about pregnancies before husbands do. You know, that people they share things with you, but it's an important exchange. It's a very
facialists. I think you hear it all.
Yeah.
Doctors.
So definitely that side of things, and I'm very much. I probably go a little bit too far in the handhold. So it might be someone who finds me. It's the aging process they're concerned about, or actually it's acne or rosacea, or there's something that's impacting them on emotionally. And I find it is that handhold, and it's that building up of rapport. And
making them sort of feel heard and I think listened to often. You know, when you are experiencing these changes that are very physical, you do need a sounding board sometimes, somebody to like I said earlier, put your mind at ease about them.
Definitely a little bit of compassion as well. We're dealing with people's faces, you know, it's a very personal thing. And I've also said with what I do from a massage and a facial point of view, it's such a privileged thing to be able to touch someone's face. It's not something we do in real life. We don't go up to a stranger and touch their face.
And your face massage is amazing. It's like legendary. But yeah, maybe we talk about the face massage, because obviously any form of massaging the face is really important to obviously keeping it feeling alive and energized, isn't it?
It is. There's lots of trains of thought around face massage, you know, and I know some people might say, well, you need to be gentle or you need to be firm, and there's so many different methods in that. And I suppose I'll come back to actually answering your previous question, Francesca.
Sorry, I know I got distracted with face massage.
No, I didn't answer you. It was my bad. I didn't fully answer you. I went off on a tangent. The whole treatment process, I like to create a nice environment for the guest. And each treatment is bespoke. So even if I've got a client who's been coming to me for years, actually, we might do some hands-on massage, we might do a peel, we might do some LED, we might get some laser involved. Radio frequency is a big one that I kind of stick into my wow factor facials. So we jigsaw things together. Sometimes a treatment might be layered and there's lots of different things going on in a facial. Or maybe if we've got a concern, we might go, okay, well, let's just step out of that slightly and let's focus on a course of something particular, and then we come back to the facials. So that's kind of how I work with things. And home care is so important, the tag team with what we're doing in treatment, and then what someone backing up at home as well.
Literally doing their homework and making sure that then when they do come to see, you know, that they've been keeping up their end of the bargain, and it makes your job all the easier as well, you know, if you know that they've been using the right products and ingredients to keep.
It does. And I mean, particularly with things like peels, if we're doing peels on them, I need to know if they've been using strong retinols that 5 days before, because it's going to impact on how the skin is going to respond. Exactly. And maybe the healing process as well. So it really is, it's a close communication. And the amount of times I get clients come in literally with their bag of skincare, and they kind of throw, and they, you know, laying out, so this is what I'm now doing. So we
all want to try sort of the newest, shiniest thing all the time as well, and we can end up in a real muddle with skincare because we're throwing all sorts of things at it, and there's no sort of specific regime, which I guess, you know, it's great to then be in the presence of somebody such as yourself who can strip it all back and you know, tell us what are the right things to be using. Tell me about the face massage, because like I said, I think that's a huge component of the facials that you do. Certainly my overriding memory of a facial with you.
So face massage, it's quite a unique practice. And I suppose from doing my beauty training 20 years ago at beauty college, I personally went off and studied sports massage for the body and body lymphatic drainage and feeding, and you know, lots of different methods of working with muscles and tissue, not just on the face. And I think that probably shifted my view of them working on the muscles and tissue of the face.
I think, you know, it's important to recognize that the face doesn't sort of stop at the chin. You know, it does go down into the neck and the back and the scalp, and you know, we need to look at the body as a whole entity in order to be able to achieve the best effects when we're treating one specific area.
Absolutely, particularly with you know, lymphatic drainage. You know, I know if I'm going to do a lymphatic drainage focused treatment on someone's face, it's actually shifting that lymph throughout the body. You know, that's the amazing thing. It's such a gentle treatment, but really quite effective.
Is it very gentle the way you do lymphatic drainage? Because I know it can vary depending on the practitioner. Yeah,
so the method I trained in was VODA, and literally they're quite a unique breed of people, the people that they just focus on VODA method. And it's very much working because lymph vessels are like threads of silk. They're really fine, dispersed within the skin, and we're draining towards lymph nodes. So if we're going to press too firm, we're basically squashing the lymph vessels, so we can't move the lymph as effectively. So
it's very light and fluttering almost.
Yeah, it's a little bit like if you were to rest a 20p piece on the edge of your finger. That's the kind of pressure that we're working with.
Wow.
And some people, a lymphatic method is really beneficial for brightening, great for acne prone and rosacea skins. I don't want to be doing deep massage and, you know, the lifting things on those type of skins. It's just going to be wrong for them.
Yeah, it's true.
And you might use different techniques throughout the facial as well. You might go deep and lifting, but then want to actually finish with some more lymphatic work at the end of the treatment.
I guess it's about looking at the face that's sort of presented in front of you as well, isn't it? And sort of being an artist in deciding actually what you need to do and where. If we're doing this at home, because obviously this is sort of going back to your point about why it's so important to use the right products and do the right things sort of with our at-home sort of maintenance as well. Are there any tips that we should have? Are there any products that you sort of recommend using on the skin first before you start massaging it?
Okay, so I would always start with a clean face, obviously. Whether it's a gentle cream cleanser or a gentle wash, you know, it's just that clean surface. You need then a product that's got some slip. So you can't be massaging, well, you could try with your serums, but it's going to be a waste of your serum. And I'm
thinking very quickly, and then it's going to be very sticky.
You know, it's just going to be very expensive face massage as well, to be honest.
Yeah, exactly.
And your moisturizers, again, you could massage with some of them, but it's not my preference. I'd rather you were massaging with some type of oil or balm. And there's a huge variety, you know, whether it's a coconut oil. I like coconut because it's solid at room temperature, so you're not going to make a mess.
Make a real mess, exactly, in the bathroom cabinet.
But there's lots of other, if you want something really affordable, you've got olive oil in the kitchen, or you've got the base oils like an almond. But then you've obviously got a huge amount of beautiful face oils that are available, you know, on the high street. Yeah, so that's kind of what I'd be doing. I do actually have a YouTube channel with lots of face massage tutorials.
Oh, amazing. So everyone can go and find that and do some DIY face massage at home.
Yeah, well, to be honest, the main benefits from an at-home, you are accessing the muscles. We are supporting some of the drainage, even though you're not physically doing lymphatic drainage, we can be supporting some of the drainage. You're stimulating blood flow, getting fresh nutrients to the skin from the inside out. And also for me, it's that moment of self-care.
Yeah, exactly.
That's another aspect of beauty and aging well, is the mental health and the self-care aspect as well.
It's so true, and it's something we've all been speaking about so much more over the past year in a pandemic, obviously. But I think it's really important. You know, a lot of people have been very much deprived of that sort of power of touch, and we know how beneficial that is to our self-esteem, our confidence, our mental health, exactly as you said. So I guess even just a couple of minutes of doing that ourselves every single day, that face massage, will hopefully do something to lift our spirits as well. I mean, talking more about the at-home stuff, because you've obviously not been able to do these lovely hands-on facials that we've just been talking about. What are the other things that we can be doing, I suppose, outside of face massage to keep our faces in check up until the point that we can sort of get back to the Beaumont and see you in your lovely spa?
Okay, so yes, skincare. I know we've already kind of touched on that already. Your core skincare routine is just really essential. But then there's obviously at-home gadgets, and I've got a few of my favorite. I've kind of grabbed a few to
oh,
share.
Amazing. Here's one I prepared earlier.
Within clinics, I think LED is just now a standard that most practitioners, whether it's medical or facial, now has an LED device. You can get at-home devices. Some are better than others. It's called a face light. It's got red and near infrared. So I find it's good for, let's say, generalized aging. LED is basically stimulating ATP, the cell energy. So I've found actually from skin consultations that I've been doing virtually, those that have acne or some inflammation going on with the skin, and they've bought or invested in an at-home LED mask, if they're using it at least 2 or 3 times a week, they're definitely seeing some improvement.
A visible result, yeah, exactly.
Yeah.
And investment, how much is something like that?
One like that is about £350. There's another one called the Desi Pro, which is more, I think it's about 1,600. There's more bulbs, it's stronger, you know, it's stepping towards the clinic. And then, but obviously the clinical LEDs that we've got, they're on a different level totally.
Oh my God, totally. And again, it sort of goes to that point of you do the things at home to sort of keep up your maintenance, but then you get into the clinic and you see guys such as yourselves and you do the real deal.
Absolutely.
What about other things? I mean, we've spoken about light, but I guess there are all sorts of like microcurrent, and what else have you got back there?
Yeah, so this little gadget, it's called a Zip.
Oh, wow. I've never heard of the Zip.
It's a microcurrent device. I think they're available in the UK on Cult Beauty.
Okay.
However, they're only properly distributed in the US.
Yeah.
There's a few microcurrent devices out there, but this is the one where the technology just outshines all the others that I've come across from an at-home gadget.
That's
and basically, microcurrent is working on stimulating your natural cell energy. You know, we've all got an electric current running around us, our natural energy. So this is fundamentally kind of waking that back up.
Yeah.
So microcurrent is great for supporting muscle tone, but I also find it stimulates, because it's that cell energy, the hydration and just the general glow that you get with the skin. Their technology just, it's on a different level. It's programmable. You download an app and you follow through different programs on the app. So I think they're a little bit pricey from an at-home gadget, but definitely well worth it. And I think they've got a lot of product. I feel like I'm doing a sales job on them.
You're not taking commission on any of these, I'm sure.
No, not at all.
A nice add-on to doing that face massage as well, just something to, you know, get the face going, and then to really wake it up with something like that.
Yeah. And then one of my other at-home gadgets, actually there's two more I'd love to show you. I've got an Oxyjet. I know we've had oxygen mentioned before.
What does the Oxyjet do?
Oxyjet is, in the clinic, you might have a Norabode Oxyjet machine, which is then pure oxygen. This gadget is pressurized air, and then the serums that oxygenate once they're applied to the skin. So the pressure feels exactly the same as the oxygen machine in clinic, but the method is different. It's oxygenating through the actual serums. Okay.
Right. So again, sort of the difference between the at-home version, but the sort of supercharged in clinic, what you would go into.
I know there are some clinics using this because it's just so handy to have around, but that is reliant on, like I said, the serums. And then another fab gadget that I've got, this is it's called the Osmosis Epic.
What a fancy name.
It's obviously not microneedling, but it's got some not sharp, just some edges to it. And I find as you're rollering backwards and forwards, it's amazing for stimulating the blood flow as well as doing a little bit of a massage. So that's one I'd probably use in the evening. It's kind of a step up to the jade kind of rollers that you'd get. And
would it leave the skin with a little bit of a flush after using it then? Hence why you're doing it at night time.
So I cleanse, put your retinols, hyaluronics, whatever serums you want, go over with this. You'll come up with a nice glow. If you want to then go on again with a serum or a little bit of moisturizer or something afterwards. But it definitely, it brings a glow. So that's a non-electric gadget.
Very, very cool. Thank you for the show and tell. So final question, Abigail, tell us, because you're midway through working on your second book, which is really exciting, all about how to age well, I think you said.
Yeah, so it's well, I say it's early days. I'm kind of roughly in chapter 6 at the moment, but it's very much looking at how we're aging and going into the impact of stress, pollution, diet, lifestyle, all of those factors, and then what we can kind of do to support that process. Aging is the one thing globally that unites us all. It's just fact of life. And like has already been mentioned, the intrinsic and the extrinsic factors of aging, we have got a bit of a choice as how we choose to age. There are certain things out of our control, but then there's other things that we can embrace.
Yeah, that's so true. I mean, everything from sort of the nutrition to how much sleep you decide to take, how you manage your stress levels. I think stress is something that's very difficult to get away from, but actually if we sort of employ more mindfulness, or we're just more aware of it, I think that's the key when we're talking about these lifestyle choices. It's just awareness often. And, as soon as you have that awareness, then you can sort of take the steps to actually minimize them and therefore their effect on the aging. But what are the things you think that we ought to be really mindful of moving forward as sort of the years go by when it comes to these lifestyle factors that you mentioned?
So stress, as you mentioned, is a huge factor. And it's interesting because I think some of us know we're stressed. And we know what we should be doing, but it's difficult to actually, put it into your life, to the steps, whether it's mindfulness, meditation, affirmations, breathing techniques.
Exactly. It can sometimes feel like an extra thing on a very long to-do list, can't it?
Yeah, but it's interesting that we would go to the gym and or a class and see that as part of our physical wellness. We need to see this as part of our mental wellness. And we can't expect, if we went to the gym once in a month, we're not going to get results. And we need to see that the same with our mental health. If we're just going to go, oh, right, I'm just going to read a well-being book just for this chapter, it needs to be that regular practice. And once it becomes regular, it becomes part of your daily routine, and it doesn't feel like that extra thing that you're having to fit in.
That's so true. That I can't remember the exact data, but they say something about it takes a certain number of weeks to make a new habit a routine, and then it stops feeling like a chore. And the other thing I actually spoke about recently was this idea of stacking all of your sort of, like lifestyle sort of supplements. So, if you're already doing something in the morning, say you're brushing your teeth, that's your time maybe to, I don't know, meditate, or it might be the time that you put on a face mask. Like you can sort of layer all of these things and try and sort of bolt them on, rather than always having to carve out additional time to do all of these things in daily life.
Absolutely. A good mantra that you repeat yourself while you're brushing your teeth.
Exactly. That's far better than meditation.
Yeah.
You can meditate whilst brushing their teeth, I don't know.
So I also think the other key thing is accepting the aging process. I think for many years we see it all the time, that women still aren't allowed to age. Out there, men get grey and handsome and the silver fox. Women just get old and saggy. And I think we need a shift of attitude to women's aging. And
talk about it in more positive terms. I mean, you're already seeing words like anti-aging being banned from sort of skincare, and I think that's such a good positive step towards being more accepting of that process.
Definitely. And I think there's the global exception, but then also that internal work that you can do, that self-confidence. And again, that obviously comes back round to the mental well-being, but confidence and accepting your body and skin and everything for what you are. Yes, we can do all these amazing things, but there's still that acceptance and confidence that I think is really important for us to, again, it's that inner work that I think is really helpful.
Yeah, I agree, and I think it's such a valid point. It's not just about what's going on physically, it's the emotional benefit of all these things we're doing, and that awareness of what sort of lies beneath the surface. Abigail, thank you. So great to have you with us. So nice to see you again. Thank you for your time.
Yeah, absolute pleasure.
So that takes us to the end of tonight's discussion. And can I just start by saying a huge thank you to our fabulous speakers. I think talking with all of you about sort of age prevention, and especially those sort of first early steps, it could be seen as quite divisive. As Abigail mentioned, we need more acceptance about positive aging. But it's been so inspiring to hear all of you talk with such conviction about the importance of, safeguarding our skin and strengthening our bodies for the future. And it's something that very much circles back to the whole point of the beauty triangle, which is really to get people talking about these issues. And of course, understanding that very real connection, as we just said, between the physical and the emotional. So thank you to our speakers. Before we finish up with a few audience questions, can I quickly remind you that when you leave the webinar, there's a short questionnaire for you to fill in. It means we can send you a helpful recap from tonight's discussion, as well as connecting you with Ifeoma, Joanna, or Abigail, should you wish. And don't forget to leave your email address if you haven't already. It means we'll enter you into a prize draw where you can win a virtual skin consultation with Illumia MD, as well as a range of their brilliant skincare. So you can do all the great work at home that we've been discussing tonight. So we had a few questions come in via Instagram, and I think there's one or two in the chat box as well. I think this first one was probably based on what Ifeoma was talking about at the beginning about exfoliation in the sequence of skincare. Is that similar to a chemical peel? Maybe Ifeoma, we can talk a little bit about the sort of exfoliation step and the different ways of incorporating that into our daily routine.
Sure. So exfoliation is important, but I think historically there's been kind of too much emphasis on exfoliation. You can exfoliate physically or you can exfoliate chemically. And we've talked a lot about chemical exfoliation with things like salicylic acid, glycolic acid, lactic acid. Now, these are something that you can bring into your routine, but they're not daily occurrences. It's something that you can kind of do twice a week, for most people, even every other week in more sensitive skin types. And you would do it after cleansing. So you would cleanse your skin and then you would exfoliate, and then you'd move on with the rest of your treatment steps.
So it's like one of those things that you would add in, like you were talking about the retinols, just as that extra sort of treatment thing, sort of once or twice a week, maybe, just to keep the skin turning over.
The other thing I would say about exfoliation is you've got to be careful with, how many steps are actually exfoliating in your routine. So what you don't want is, you don't want to have a cleanser that's exfoliating and then a serum that's exfoliating and then a retinol. So that's also where you can get tripped up. So label your exfoliators and know which product can be exfoliating, and make sure you're only doing 1 or 2 in your routine.
That's really smart advice. Thank you. One of the questions that came in ahead of tonight's talk was about Botox. I might throw this one at you, Joanna. If I start Botox and then stop in the future, will it make the aging even more noticeable? I feel like this is something that gets asked quite a lot when it comes to sort of starting the injectables.
I was just about to say that. It's a very common concern, if I do this and then I don't continue with it, how will I look? And the answer is in reality, if these treatments are done well, so it always comes back to the kind of expertise of your injector, you should only be in a beneficial position once you stop treatment. So in the case of Botox, for example, you relax the muscle, you've augmented how it's behaved. If you were to never do it again, you should still retain some relaxation in the muscle for a period of time before the full strength of the muscle comes back. In the case of filler, if you haven't overbuilt or augmented the face, you've just simply restored what was naturally there, you can't possibly stretch the skin or do anything weird on the face, and so that filler will just be metabolized and slowly break down, and you will go back to your baseline. But if it's done well, you should never be in a worse off situation from before.
It's very much sort of holding your face in the place that it needs to be, sort of long term, and maintaining.
Preserve rather than augment, and you can't go wrong.
I think that's very wise words there. One of the ones that came in for Abigail ahead of this, are there any natural remedies or supplements you recommend that can help with acne related to PCOS, so polycystic ovarian syndrome? Is that something that you sort of deal with at all, Abigail?
Yeah, so where we've got an underlying PCOS, we can't fight those hormones that are going on. I will always refer to a nutritionist in that instance. The usual kind of supplements are making sure that you've got vitamins A, C, E, zinc, and your omega oils, your essential fatty acids. So those are the usual.
What are they doing to the skin?
It's a little bit like your skincare, actually. I was kind of thinking, because I thought you might ask me about supplements, and I've kind of thought that actually the key ingredients we now know in our skincare, vitamins A, C, E, all of those, and those are also the key things we're looking at from a supplement and a diet point of view as well.
So true.
Yeah, but I do find with an acne prone skin, it is so individual, and especially where we've got an underlying hormonal issue that, might be being medically treated or hormone therapy or whatever it might be. We've got to, from a nutritionist point of view, they're going to want to support the liver. It's not just chucking these supplements at them. So it's a really fine tuning. And that's kind of where I have to say, this is why my skill and knowledge ends. And I need to pass you on to another expert in their field so that we can then work as a tag team.
But it's also, to go back to your point about working holistically, I think sometimes that does mean knowing the best practitioner to then refer onto as well, just like Joanna or Ifeoma would, at some point refer to a surgeon if all of the techniques that they were doing sort of weren't quite sort of addressing the issue. I think it's important to recognize where your sort of skill and authority sort of begins and ends. We had one comment about hollow eyes, and I think this might be a good one for Joanna. What's the best way to treat hollowness that appeared around the eyes following pregnancy? This lady is no longer breastfeeding, so I guess the sky's the limit, Joanna.
Okay, so we have to look at the origin of the problem, because people will focus on the eye area because it's an area that we do seek beauty on the face, but it may be that there are other anatomical considerations. For example, there may be loss of volume within the temples, and what you don't want to do again, this is just for instance, is kind of bulk filler under the eyes, where you could be kind of lifting and restoring from the lateral part of the face. And when you do fillers in the temples, you know, the back part of the cheek, it does kind of sort of support the anatomy and pull it all up into place. So there are volume considerations, but not necessarily directly under the eyes. There are skin laxity and sort of ligament tightening considerations as well. And that's where we would defer to treatments like radiofrequency, HIFUs, and ultrotherapy around the eyes. So it's kind of a combination of potentials. We need to look at what is most impactful in that person, and the multi-layered, you know, approach to addressing different elements of the anatomy, so you don't ever overdo one thing. You kind of look at the complement as a whole and get the right combination to give you a natural result that delivers the result you want as well.
Exactly. I think that's really smart. Ifeoma, is there anything to add there in terms of all of the energy-based devices, I don't know, skincare that can sort of help in that eye region?
Absolutely. You know, just as Joanna's saying that when there's people describe dark circles, but it's multi-level. With breastfeeding, I actually always talk about vitamin D as well. That's calcium and vitamin D, so to support the bone. And with breastfeeding, we know that it does leach away at some of your vitamins, specifically vitamin D, if you're not supplementing. So supplement because of the bone. We've talked about the fat. Fat is the level of filler. Then it's the skin. So often when you see darkness in the eyes, some people think it's pigmentation, but actually the skin may be thin. So what you're actually looking at is muscle.
It's the muscle that shows through and can make the eye area feel very dark. Exactly.
So doing treatments that will strengthen the muscle and build collagen. So again, that can be skincare, things like retinoids and niacinamide. That can also be treatments like microneedling and HIFU to thicken the dermis over time. So it's thinking about the different levels and a treatment for each of the levels to improve the hollow. And if it's pigment, if it's genuinely pigment, then you can have things like chemical peels or topical tyrosinase inhibitors like arbutin.
And you can take those safely sort of right up to the eye, can you?
With the eye, there's one key element, that dehydration in the eye. If the eye is tired or is dehydrated, hydrating the eye with things like hyaluronic acid and ceramides can be extremely beneficial prior to doing almost any other treatment, to make sure that you get a better result.
Okay, perfect. So again, all of the sort of at-home prep you can do for these things with the right products. I think final question, which is for Abigail, also one that came in. There's someone who loves using facial oils but is prone to breaking out. Are there any you would suggest which are suitable for oilier skin types? What are your thoughts on facial oils there?
Yeah, so a safflower oil is slightly finer. Hemp and borage. I would generally stick away from what I'd call the beauty blended oils, the ones that have got the aromatherapy in, unless
anything that smells very nice, if it's a natural scent.
It's going to be better and safer to literally tailor it back and go for a single oil. I'd definitely be avoiding your coconut oils. They're going to be too rich, and I think even a squalene is an option as well. But are they just oily, or are they getting acne?
I don't know, or prone to oiliness.
Okay. I'd also be looking, as much as they're asking about what oil they can use to massage with, if it's prone to oiliness, I'd actually be wanting to readdress the whole routine that they're currently using, because there probably is some rebalancing from tweaking their home care that would benefit their skin as well.
Okay, that's interesting. So actually, if oiliness is somebody's main skin concern, maybe work backwards and address that first before just trying to pick a product that it's sort of like addressing root cause rather than just finding something.
Yeah, yes, absolutely. I know when it comes to face massage, people just want a product that they can massage with, but I would just want to make sure that by adding that regular oil to the skin and stimulating things with the massage, we're not kind of just disrupting. So it's looking at that whole picture. Okay.
No, that's smart. And also you did say earlier that you can use this sort of nice wash or a cream cleanser or whatever else it is you're using. So maybe, stay clear of the oils and go back to using something else for your face mask.
Yeah, well, you can do quite a nice face massage with a cream cleanser.
Yeah, exactly.
Really gentle cream cleanser, you can still get that movement. And if you are insistent on using an oil, one of those that I've just mentioned, I'd always use a gentle wash afterwards, so you've not got too much oil left on the skin.
Very smart. Okay, lovely. Thank you for that, Abigail. I think that's probably it for tonight. If there are any other questions that obviously come in for our brilliant panelists, then just drop us a message on Instagram. You can email us and we can try and get those answered for you. But otherwise, I think that's it for tonight. So from me, a final thank you to our amazing Beauty Triangle panelists. It's been amazing to hear all of your incredible wisdom and tips and guidance, many things that I know I'm going to be instilling in my own regimes at home. To everyone who joined us tonight, thank you very much for spending your, gosh, what are we, Wednesday evening with us. Such a pleasure to have you here, and I hope you found tonight helpful. We'd love to see you again at more webinars and talks as and when we get those up and running, hopefully post-pandemic. And when the lockdown starts lifting. So keep an eye on our website, thebeautytriangle.com, and we will aim to keep you posted on all of those. But that's it. Enjoy the rest of your evening, everybody, and thank you once again for joining us. We will see you next time. Bye.